Well, all I have to do is speak for 30 seconds and you'll know I'm from New York. I'm a transplanted New Yorker. And one thing that I found when I came to Chicago was some similarity in terms of lots of different neighborhoods, lots of different communities. And like New York, we in Chicago have communities that are more affluent, and we have communities that struggle and face lots of barriers to good health. So if you lived in Streeterville, one of the more affluent communities, or you lived in Englewood, just 9 miles south of Streeterville, there's a big difference. And there's good news and there's bad news. If you live in Englewood, the good news is undoubtedly you're paying less rent. The bad news is undoubtedly your lifespan is going to be shorter than if you lived in Streeterville. The late founder of Sinai Urban Health Institute, Steve Whitman, used to say, if a Martian came down to Chicago and you walked down the street with that Martian, you'd be able to point at 2 people that you had never met before and say to the Martian, this person is going to die 10 years earlier than that person. The Martian might be totally amazed at your predictive abilities and say, well, how do you know that? You never met them. And Steve would say, because in this country, we've arranged the systems so that the darker your skin, the shorter your lifespan. That's true depending on what your zip code is. But there are solutions to that. But before we get to the solution that I want to talk about today, let's just take a minute and look at what all the barriers are to good health. We're not going to talk about all the barriers today because unfortunately there are so many. Just going to touch on a few because we've got good solutions for some of those barriers. If we look at the barriers, for example, of unemployment, we all know unemployment, long-term unemployment is inextricably linked to poverty and poor health. And in some of the communities that Sinai serves, we have as much as 5 times the unemployment as the rest of Chicago. Now, what I'm quoting you is pre-COVID. Just imagine what that number is now. And here's how that plays out. People start making decisions about taking their scarce dollars to pay for rent, to pay for food, or do I go get health care? And in some of the communities we serve, we have a high proportion of single female heads of households. And those folks are making decisions. Do I take time off and go get a screening mammogram? Or do I make sure I keep that job that I desperately need? And so in some of our communities, breast cancers are being found way later than they would have if people were going for those screening mammograms. Second issue, and we could pick so many, sadly. Second issue, mental health and violence. It's obvious. If you're a victim of violence, it leads to bad health, right? But what about the lingering effects of violence? If you've experienced violence or you've witnessed violence, you're going to have post-traumatic stress disorder, most likely. And in some of our communities, this is research coming out of our Sinai Urban Health Institute. In some of our communities, and this is going to be stunning, 1 out of every 4 people reports having post-traumatic stress disorder. 25% of people in some of the communities we serve report post-traumatic stress disorder. When I first saw that statistic, I didn't have a context for it. And I thought, you know what, I'm going to go, find some relational benchmark for this. Like, what does 25% mean? And what I found was that at the time, it was higher than post-traumatic stress disorder being reported by returning veterans from war in Afghanistan. This is our city. And we have a higher report of post-traumatic stress disorder than those serving in a war. So a third example, and then we're going to start talking about solutions. A third example is what I'm going to bucket under the basics. Food, safe, reliable housing, safe neighborhood to walk around in. When we think about food, our research shows that in some of our neighborhoods, 1 out of every 2 people say they don't know where their next meal is coming from. It's not in all neighborhoods, but it sure is in the neighborhoods that Sinai Health Institute serves. 1 out of every 2. And people make decisions about where they're going to spend their money. similar to the unemployment issue. And I'll give you an example, a real example that one of our social workers dealt with. And I hope that this kind of brings it to life to you about how people are making decisions. We have a social worker named Carol. And Carol worked with a community resident. She was frequently being admitted to Sinai Health System for congestive heart failure. And Carol had a great relationship with her, would talk with her about the things that she needed to do to stay well once we got her well. And one of the major things was weigh yourself. So we'll know if you're retaining water, because that's one of the first signs that you're going to suffer from congestive heart failure. And the patient said, yes, I got it, I'm good, and then would get readmitted. In frustration, Carol said, I don't understand, we talked about this. I know that you understood what you were supposed to do, what happened? And the patient looked down and said, I was too embarrassed to tell you, I can't afford a scale. I've never had a scale. And so these are the kinds of things that I can tell you, these things were not on my radar when I came to Sinai first, and they're not things that I think of first as barriers to good health. But these are the very issues, those are just a few examples, these are the very issues that keep us from being healthy in these vulnerable communities. So what do we do about that? You know, it's just unconscionable, it's just unforgivable that there should be two levels of health care. One if you live in 60611 where I live, and one if you live 6 miles west in 60608. But that's what we have now, and that's why we need solutions. And I've come to the realization that the solution is not the hospital knows what's best for the community, and we're going to tell you how we're going to do it. These solutions have to come from the community, and they have to be in partnership with the community. And we've got some great solutions that we're going to talk about today that are, I think, elegant, and they're easy to implement, they're not expensive, and in my opinion, we just need to do them. And we need to do it in partnership with the community. And the one thing that I really want to stress today is the use of community health workers. This is not a new concept, really. And there are community health workers throughout the entire nation, but not to the degree that we can use them to really start getting at some of these barriers. So let me tell you first what a community health worker is. It is, as the name implies, quite simply, somebody who is a trusted and respected member in the community. Might be somebody who currently is unemployed. Remember that unemployment number? Unemployed. Could be somebody who's underemployed, maybe working a few jobs just to get by. Or somebody who simply wants to get deeper into healthcare and help their own community. So Sinai Health System takes people from the community. We've been doing this for a long time. We've done this nationally with others, and we've trained others across the country. We take people from the community who are interested in this profession, and we train them in identification and education on these very chronic diseases that plague so many of our vulnerable communities. Diseases like diabetes, pediatric asthma, breast cancer, congestive heart failure. There's so much more burden of these diseases in these communities. So we train them in identification, education, how to get people into care if they're not in care. And these people are their neighbors. We're putting them back into the communities. We're hiring them. We're giving them a job. We're giving them benefits. We're giving them a career path. And we're putting them back in the communities that they come from, that they know, to work with their neighbors and their community residents because they are trusted and they are respected in the communities. And they work with their neighbors about, how do we get you into care? Are you at risk? Let's get you tested. Once you're in care, how do I make sure you're getting to your appointments? And it doesn't stop there. It's also looking at the very things that keep exacerbating these conditions. And I'm going to give you an example that's really going to bring it to life for you in just a minute in pediatric asthma. But it's about advocating as well, because it's not just about the health care. It's about all of the things that keep people healthy, and it's about removing the barriers that stop people from having good health. So let's imagine two hospitals, and trust me, I've been doing this a long time, every hospital has a community outreach department. And what typically happens is people will go from the community outreach department. Let's take one hospital. One hospital goes to when we had community events, and we will, again, may not be for another year, but we're going to have community events again. But we would take a table, and the hospital would put out the brochures and the flyers, and maybe there'd be a blood pressure machine. We take your blood pressure and let you leave with some information about our health system. Funny thing is, in hospitals that did community outreach like that, by and large, we're not seeing a big shift in the proportion of people who have diabetes, or in infant mortality, or in bringing pregnancies to term. And I could go on, but let's picture a different hospital. The second hospital invests scarce resources into community, into hiring from the community, into having community advisory councils, into listening to the community. That hospital does a big community survey, 500 questions, bilingual. Not a single one of those 500 questions that cover not just health, but issues like post-traumatic stress disorder, issues like insurance and eyeglasses and food and housing and safety. Not stopping at the healthcare. 500 questions, not a single question, picture this, not a single question gets on that survey unless the Community Advisory Council says, that's an important issue for us. We need help. We need partnership in that. So that hospital is working with the community, listening deeply, partnering with the other organizations in the communities, in these vulnerable communities. Other organizations, one might specialize in legal aid, one might specialize in affordable housing, another could be job creation and job development, but you think back to where we started? These are the things that keep people from being healthy, and it's all got to be in partnership together. So I'm going to give you two quick examples of community health workers and the impact, one in breast cancer and one in pediatric asthma. In breast cancer, I already told you what the women in our community suffer with in terms of making the decision about coming in for a screening mammogram. So we have a community health navigator. Her name is Susie. And Susie's job is to make sure that if somebody's due for a mammogram and their name is not on that schedule, Susie's calling them. Saying, hey, I'm Susie from Mount Sinai Hospital. I noticed that you're due for a mammogram, but I don't see your name on the schedule. Can I help you today to get your name on that schedule? What's keeping you from coming in? Because this is so important. What's keeping you from coming in? Do you need transportation? Do you need somebody to watch your kids while you get the mammogram? Do you need somebody to talk with you to your employer and work that out? Do you just need somebody to come with you because you're afraid to do it? Because I can do any or all of those things. And I will tell you, I get all of my health care at Sinai, and I know that this is true because when I first came to Sinai 14 years ago, I got a call from Susie when it was time for my mammogram. And she took me through that same script. And you know what? I know firsthand how good it feels as a patient to feel that somebody wants to help me get health care. And I don't need that help. Just imagine how good that is and how effective that is for the people in our community. And by the way, since we started that program, cancers are being found much earlier. So last example, pediatric asthma. One of my favorite colleagues in a sea of favorite colleagues is a community health worker named Kim. Actually, she's a senior community health worker now. When she joined us from the community, did not have a job, and has been with us for a number of years. Her passion, her love, is pediatric asthma. And what Kim does is go into homes, and she works with the parent or whoever's taking care of the children. And she literally says, well, how many children, in the family have pediatric asthma? And what we're finding is if there are 3 children, maybe the family has 1 inhaler or 2 inhalers, and the kids take turns bringing that inhaler to school, playing Russian roulette. Hope I don't get the asthma attack today. Kim makes sure there are enough inhalers. She makes sure that if the doctor has said, you have to do this twice a day, that the parents aren't doing it 10 o'clock and 11 o'clock trying to be efficient, but that they understand it needs to be spaced out. Kim makes sure that the home isn't a trigger for pediatric asthma. What good does it do for us to make sure that the kids are having the support that they need in terms of inhalers and education, but every day they're walking right back into a home that's a trigger? Kim looks at the walls and she says, there's mold over there. We've got to talk to the landlord, and that's what Kim does. She might also, while she's at it, say, shag carpeting, that's a trigger. Or there's a pet dander, we have to do something about that. But Kim advocates for her families. It doesn't stop at the health care. And Kim does such an amazing job that several years ago, we won an award from the Environmental Protection Agency because of the cleanup in multiple homes where children were suffering from pediatric asthma and missing school and having to go to the emergency department in the middle of the night and then missing school because everybody was just too tired the next day. Kim has changed that as a community health worker. And if all of that isn't enough to have you believe, as I believe, that this is a great solution, you should know that for every dollar we invest in our community health workforce, we're saving $14 from averting emergency department visits and hospitalizations. So this, to me, is an elegant, scalable, manageable solution that for the life of me, I cannot understand how we're not scaling up community health workers. Even as a hospital administrator, I want to keep people healthy where they live, and that's in the community. Because what I care about is 5 years from now when that Martian comes down and says, can you tell me who's going to die sooner? I want the answer to be, well, I don't know, and certainly not based on the color of the skin. Thank you.